Hi, my name is Yuki Zhang, and this is my final project dashboard for data visualization. The dashboard visualizes substance use and mental health in college students. The goal is to explore how substance use behavior related to mental health outcomes across different student groups. The data are collected through surveys across the university in United States in 2025. At the top, the session summarized the current number of students in Will, the percentage with any substance use behavior, the percentage with any mental health problem, and the percentage with positive mental health. This is determined by students' questionnaire score. On the right side, there is global filters for student characteristics such as sex, international student status, how many years they are in the college, residency, age, and their field of study. User can select a variable by clicking or sliding through the mouse. For example, here we select students for more than 21 years old or 21, and we can see the percentage of alcohol use increases in this older student group. This makes sense because students who are 21 or older are legally allowed to drink. And let's reset this. Here are two bar charts. The first bar chart shows the prevalence of substance use behavior. For example, it includes alcohol usage in the past 2 weeks, binge drinking 1 times or 3 times in the past 2 weeks, cigarette use, cannabis use, and no recreational drug use. This gives a quick overview of which behavior are more common in the current selected group. The second bar chart shows mental health outcomes and well-being indicators. Most of the bars represent risk outcomes such as depression, anxiety, self-injury, suicidal ideation, and any major mental health problem. Notice that the positive mental health does not equal to having no major mental health problem. We can see the number of students in each bar from the tooltip. Clicking a bar will add the variable to a link filter. The whole dashboard updates to show only students with that selected behavior. After the selection, the summarized pie chart and the number also changes. This allows us to ask questions such as how does mental health change with different substance usage behavior? User can also select multiple substance behavior. The selected bar are treated as an interactive focus group, and the other chart updates get together. User can also filter in the mental health bar chart, which offer the same interaction as the substance bar chart. Let me reset them. Now let's see the PCP plot. Here, each line represents a group field of study, such as art and humanity, undecided and not answered, health and clinical, business and built environment. Each vertical axis represents a substance use or mental health variable. Here in this menu, user can decide which variable to be represented as the axis. The variables are divided to 2 groups to help user fast navigate through the topics they want. Hovering on the line will show more detailed information. Clicking a line here allows user to select that field group, and the rest of the dashboard also updates. User can also drag a rectangle through the axis to select a certain range of lines. Through this button, user can switch to check individual measures. This gives a more detailed view that each line represents a more specific field of study. When clicking one specific measure line here, the dashboard filters for students who select that measure. Because students can do more than one measure, these faded lines represent overlapping fields within the selected group, not the original data. You can also select a range of measures here. If we select a range of measures, we can move the mouse here to see what measures be selected, because the lines can get crowded in the individual measures view. Here for the heat map, it's designed to show relationship between variables. The color represents difference compared with the overall prevalence. Warmer color means the outcome is higher than the overall rates for that group. The tooltip shows more detail behind the color, including the prevalence in the group, the overall prevalence, the difference between average, and the group size. User can click a cell to filter the dashboard to students who satisfy both conditions. For example, here is houseless students with been drinking once in the past 2 weeks. Now let's see the buttons for the heat map. User can select different variables for each axis. The dashboard provides buttons to quickly select and deselect the entire group of variables. The switch button here allows to switch between X and Y axis. And this button supports brushing in the cell. Instead of selecting one cell at a time, user can drag over the region to select multiple relationships together. And they can also deselect using the same dragging. This button clears all brushings. Here in the bar chart for substance usage, students who report cigarette and cannabis use shows a higher rate in any major mental health problems comparing with the overall population. Alcohol use also has a difference, but the gap is much smaller. When looking at the individual measures in the PCP, for mental health related axis, we can see that the art and design measure has a relative high rates on several mental health indicators. This is elevated mental health risk profile comparing with many other measures. The law measure group also stand out. It has the highest alcohol use rate while having a relatively low rate in mental health indicators. For positive mental health, we can see that the medicine students having the highest positive mental health rate with a very low rate of cigarette and cannabis use. This may invoke us to think about how education affects substance usage behavior. In the heat map, the cannabis cell for international student group is blue, which means cannabis usage is lower than the overall average among international students. At the same time, the cigarette use cell is slightly red, which suggests international students smoke cigarette more than the average. And we can see that international students have 10% more no recreational drug usage. This may imply different cultural background, social environment, or access and attitude towards different substances can affect how students use recreational drugs. Another clear pattern appears for Greek and co-op housing. In the heat map, this group has a very red cell for alcohol and binge drinking 1 time in the past 2 weeks. And it's also red for most other substance use variables. Here are more noteworthy patterns to discover in the dashboard, such as male students shows lower rate in mental health burdens, while houseless students shows a much higher rate in mental health issues. I will stop here in the video, and thanks for watching.